By training, I'm a general internist, and I spent most of my professional career trying to write decision support tools to let people who are not physicians mimic the performance of physicians doing a bunch of different kinds of things. One of them is the issue of can you on a smartphone do what nurses currently do in call centers as a consumer. Everybody in here has been in this position before. You don't feel good, you don't know what to do, and you got to figure out what you're going to do next. Well, you can call mom. If you still have books in your house, there are books that you can look into as to what you might want to do. You can try to go to an urgent care center. You can call 911. You can go to an emergency department. You can try to call your doctor. I would not recommend the latter, because the latter you'll get a recording that tells you if you think it's an emergency, you should go to the emergency room. You can play the odds. Chances are it's nothing. Okay? Most stuff is simple, and most simple stuff isn't bad. And if you like that odds, you just don't do anything. Or you can just wait and see what happens. It's kind of another version of the dummy. You could call a call center. Nurse-based call centers have been around since the mid-90s. They generally are sponsored by employers, or they are sponsored by payers. They work exceedingly well. You're interviewed by a nurse who's using a decision support computer software package that sits underneath what they're doing, and make certain that they ask questions that are appropriate to your problem. They are proven safe. They have very little no out-of-pocket costs to the individual users. The downside is that's so nice. Everybody has a cell phone. Nobody talks on it. Most people use it as a computer as opposed to a telephone. And I've got kids who would no more call somebody to ask them what to do, even if it's something like this. They would instead go online. That's the way everybody solves problems, or lots of people solve problems these days. And all of these are organizations online where you can go and they will tell you that they have a symptom checker of some sort. The problem is that the best you're going to get on these sites is a list of conditions that can cause your problem and some estimate of how common they are. So it's a lot like going to the doctor, and after the doctor's examined you and talked to you and done tests, he says, there's 75 things that could cause your problem. Here's that list of 75 with a descending list of probabilities, and here's the reading list that you can go to figure out what to do next, because that's what these websites provide you. They provide you access to a medical library, but what you really want is guidance. You really want to know what you're supposed to do next. You don't need to know what's causing it. The only reason you might want to know what's causing it is because that would lead you to know what to do next. The hard thing is not what it is. The hard thing is to know what to do next. If you're going to do this online, the tool you use has to have these three characteristics. It's got to be web-based. It's got to be mobile-based. It's got to use the same kind of robust underlying medical logic that nurses use in call centers. This is not simple stuff. And it has to provide a recommendation as to what's medically most appropriate. It can't just tell you, now that you've finished doing this, go look at the library. It has to simultaneously be broad. You can't read this, but this says, is this an illness? Is this an injury? Is this a skin problem? Is this a mood or behavior problem? You can't just have a list of the most common things. You have to cover lots of things. And it has to be deep. And there are lots of things that you need to know about somebody who said, my neck's causing the problem. Well, is it your neck? Is it your throat, the back of your neck, the front of your neck? And while you're doing that, it has to consider causes both rare and common. Okay? Rare things are rare, but rare things also, some of them are really bad, okay? And they can kill you. So it has to consider those as it goes through the process of collecting data and trying to give you a recommendation as what to do next. And ultimately it has to give you a recommendation. It has to be a recommendation that has some spectrum to it. It can't always tell you to go to the emergency room, or I told you that at the beginning. Okay? And it can't always tell you to stay home, because that's not the right thing to do all the time. And it has to present that information to you in a way that will sell it to you as a medically appropriate thing to do. And I don't use the term sell in pejorative sense. These only work if people accept the recommendations. In nurse-based call centers, 95% of the people end up following the recommendation that's given by the nurse. The numbers from the online systems seem to be the same. I said it's not simple. This is simply the question-answer sequence for low back pain. Somebody says, my back hurts back here, the bottom part of my back. Okay? It's hard. And you need about 60, 70, 80 of these in order to do it. Okay? There are sources for it currently in the United States online. And the answer to my question that I started this with is, you can replace about 35% of the calls to a nurse-based call center can be totally handled online with an online system. We can talk about how you combine the two systems sometime else.